road to weight loss can be challenging, to say the least, whether you're looking to lose a little or a lot of weight. It can be frustrating when the numbers on the scale don't go your way, even after dieting and exercising. Dr. Folahan Iolo, with Weight Loss Specialists of North Texas, joins me to explain his approach to patient care and how he wants to help you reach your weight loss goals. Good morning, doctor. Great to have you.
Good morning. Thank you.
So, why are you so passionate about helping people live free from obesity? Curious.
You know what? In one word, it's health. A lot of times when people think about weight loss, they think about the cosmesis of it. But I do what I do because health is wealth. If you don't have your health, nothing else matters. And the more weight you're carrying, the shorter your lifespan. So we want to help people, live longer.
You said several truisms right there, just in that one thing. Okay, so what can people expect from working with you specifically and your practice?
Well, we say we give compassionate care that gets results. But what's even more important is we give all options to people that want to lose weight. I have a dietitian on staff, a nurse practitioner. So we could do things like lifestyle, diet, exercise. We could do medications as well. All those injectables everyone's hearing about, they're very popular. We do those as well. And of course, I am a surgeon, so we have the surgical options available to patients as well.
So you have all these different options that are available depending on the patient. How do you know, for instance, if someone needs surgery?
Right. So what we do is there's a society called the American Society of Metabolic and Bariatric Surgery, ASMBS, and they put out guidelines on when you should do surgery, when you should do medications based on data and science. And so that's what we follow, the ASMBS guidelines.
And so besides weight loss, you also do other surgical procedures, is that right?
Yes. So everything, I think one of the most important things is everything we do is physician supervised. And so we also do gallbladder removal. We do reflux surgery, we fix hernias, and all of this is physician supervised, so you're not getting fads or anything like that, you're getting the real deal.
Okay, well, as we said at the outset, weight loss can be very, very challenging. If someone's watching right now and wants to start the process, how do they reach you?
We're everywhere. In terms of location, Denton, Frisco, Flower Mound. You could go on our website, weightlosssurgeon.com, to get the process started. And you can give us a call. I think we got the number posted on the screen there.
And why there are various weight loss facilities around, why would you tell viewers they should choose you as opposed to another service?
It's number one, compassionate care. I really honestly believe in meeting people where they are. We take time to listen to your story, understand what your struggles are. There are the ASMBS guidelines, and then there's reality of where people are mentally and emotionally and what's going on in their lives. So I think it's important to take time to understand that first, and then come up with a good plan on how to move forward. I would say the second thing is we view this as a lifelong journey. So this isn't something we do one time, check the box and keep moving. We're with you lifelong, because unfortunately losing weight is a lifelong battle. And so we want to be there for patients all the way through.
Thank you so much for coming in this morning and telling our viewers about this.
Appreciate it. Thank you.
Great information. Thank you for joining us. Again, if you'd like to learn more and find a plan that fits you, call 940-382-9429, or you can also visit weightlosssurgeon.com, and we'll be right back.
What do you think of when you hear the words bariatric surgery? If too many complications or everyone regains all their weight back comes to mind, then you haven't taken a close look at bariatric surgery outcomes in the last decade. It's true, in its early days, bariatric surgery was not commonly performed or accepted. It was performed through large incisions and complication rates were higher. In the last 20 years, though, a lot has changed. Bariatric surgery is safe. In fact, bariatric surgery is now as safe as gallbladder surgery, hip replacement, and hysterectomy with a mortality rate of 0.2%, which is far lower than most other elective operations performed today. Speaking of mortality, we also know that people with obesity have a shorter lifespan than people who are not obese. A middle-aged man with a BMI of 40 is expected to die 7 years earlier than someone who is normal weight. If your BMI is 55, your life will likely be 14 years shorter. For comparison, these are the same early mortality rates seen with normal weight people who are actively smoking. Why do people with obesity die early? Because obesity causes them to develop heart disease, diabetes, and cancer more frequently than non-obese people. Bariatric surgery, on the other hand, increases life expectancy. Compared with obese patients who do not have surgery, bariatric surgery patients can expect to live 30 to 40% longer. Why? Because weight loss and metabolic improvements after bariatric surgery make the risk of heart disease, diabetes progression, and cancer decrease dramatically in most patients. Current procedures do not cause malnutrition. The two most commonly performed bariatric surgeries today are sleeve gastrectomy and gastric bypass. Both are done laparoscopically, with complication rates less than 5% and an average hospital stay of 1 to 2 days. Both procedures are effective and durable. 1 year after surgery in a typical patient, the average weight loss is 80 to 100 pounds for sleeve gastrectomy and 100 to 150 pounds after gastric bypass. Patients need to take lifelong vitamins after both procedures, but these are not malabsorptive operations that cause severe nutritional deficiencies. In fact, bariatric surgery patients continue to absorb every calorie and every gram of protein that they eat. And they eat a regular, healthy diet in smaller amounts and have normal bowel habits after these operations. Most patients do not regain all of their weight. Some weight gain is normal in the long run, but only 10 to 15% of patients regain a lot of weight years after surgery. Remember, we're talking about chronic condition here, and we've dramatically changed the trajectory of the disease. Most patients don't maintain their lowest weight after surgery. Their body adjusts to a new set point above that, and over time, a few pounds will come back on. Again, it's normal. Even with some weight gain, patients enjoy a better quality of life, fewer medical problems, and way less than if they hadn't had the surgery. Bariatric surgery should not be a last resort. Like any other chronic disease, the earlier you treat obesity and its metabolic consequences, the better the outcomes. If treated at an early stage, weight loss is better, diabetes remission rates are higher, and years of life are added. If used as a last resort in a patient with severe medical problems and limited ability to move, we can't expect the same great results. If you were told you had heart disease, you wouldn't wait until you had a heart attack to get treated, would you? We all know that if you treat cancer when it's detected early and before it had spread, the chance of a cure is much higher. The same idea applies to treatment for obesity. It's a deadly disease, so why would you wait years to get it treated? Safe, effective, durable, life-saving. Sounds like a great option to treat a life-threatening disease.
Have you ever used a body mass index calculator to get your BMI number? It's easy. Just search the internet for a BMI calculator and plug in your height and weight. Confused about what your number means? Wondering if you really need to be worried about your weight at all? I mean, sure, you've gained a few pounds over the years, but it's not that big a deal, right? Well, answer these questions. Are you 100 pounds heavier than you should be? When you calculate your BMI, is it over 35? Over 40? Do you also have diabetes, sleep apnea, high blood pressure, or high cholesterol? If you answered yes to 2 of these questions, you qualify for bariatric surgery. That's right, you have severe obesity, and ignoring it or taking more pills for your medical problems isn't wise. In fact, your life expectancy is at least 7 years shorter than someone who didn't answer yes. If your BMI is really high, like 55, you're likely to die 14 years earlier than you would at a normal weight. It's time to get a sense of urgency about this problem, and it's time to face facts. Obesity is a chronic disease, and it needs to be treated. It's easy to blow it off now because it doesn't hurt or cause a lot of symptoms. But just like cancer and heart disease, it will progress without treatment, and it will end your life early. If you have obesity, it's not just a willpower problem. You've tried 100 times to lose weight with diets and exercise, so willpower isn't the issue. It's biology, environment, genetics, and yes, it's behavior too. If you're obese, you just have to own it. It doesn't mean you need to be embarrassed or ashamed. Would you be embarrassed if you were told you had diabetes? No, you would get it treated. Same should be true for obesity. Unfortunately, many doctors don't have the time or expertise to discuss or treat obesity. There are experts out there, though, that focus their careers on treating this disease. Bariatric surgery programs offer all kinds of treatments for obesity, including medication, endoscopic treatment, and surgery. Learn more about these safe and effective treatment options. Check your BMI and take charge of your health. Bariatric surgery. You probably think it's an extreme solution for people who end up on TV shows like My 600-Pound Life, right? Did you know the typical bariatric surgery patient is a woman between the ages of 35 and 50 and is about 100 pounds overweight? Not extreme at all. Take Sarah, for example. She's a 45-year-old wife and mom of 3 kids. She's 5'5" and weighs 245 pounds. That means her body mass index, or BMI, is 41. That's too high. In fact, anyone with a BMI over 30 has the disease of obesity. Sarah's parents were heavy, and she has always been bigger than her friends. But in the last few years, she has steadily gained weight despite her best efforts. Oh, by the way, she takes medicine for high blood pressure, was just diagnosed with sleep apnea, and her doctor told her she has pre-diabetes. She goes to the gym 2 or 3 times a week and eats a pretty healthy diet, but her weight is now out of control. Sarah wants to be slimmer, but like most Americans, she thinks it's a willpower problem. She has always quietly fought this battle on her own, but is now at her wit's end. The straw that broke the camel's back was when she was too big to get on the roller coaster last summer with her kids. What Sarah doesn't know is that in addition to the frustration she feels about her weight, obesity has put her on a path towards heart disease, type 2 diabetes, and many other life-threatening chronic diseases. Most people think of obesity as a defect of character. People with obesity are often looked at as lazy and undisciplined. That's not the case for other chronic diseases, though, and it shouldn't be the case for obesity. Like cancer or heart disease, obesity is a combination of environment, genetic, and lifestyle factors, and left untreated, it's deadly. Sarah doesn't want to drag her feet until she develops diabetes, has a stroke or heart attack, or worse. So she takes action and asks her doctor to help her find effective treatment. Once she realizes how much her weight is putting her health and future at risk, she considers having bariatric surgery. Sarah's bariatric surgery team talks to her about 2 options: sleeve gastrectomy and gastric bypass. Both procedures decrease hunger and improve feelings of fullness when eating by decreasing stomach size, changing hormones released by the gut, and altering the way Sarah's stomach talks to her brain. Unlike dieting, Sarah's body won't fight back when she rapidly loses weight after bariatric surgery. Over time, her body will find a much lower and a much healthier set point for her weight that she can maintain. After talking with her surgeon, Sarah chooses to have a sleeve gastrectomy. The surgery is done laparoscopically with a few small incisions, takes about an hour to complete, and she spends 1 night in the hospital before starting her new life. 1 year after surgery, Sarah has lost 90 pounds. She no longer takes blood pressure medicine or uses her CPAP device, and her blood sugar is normal. She feels great and still exercises 3 times a week, but can do a lot more in the gym now. She still eats a healthy diet, but her portions are smaller than before. She knows she has to work hard to maintain her weight now, but she has the tools to do it. Most importantly, she has tons of energy to play with her kids and is back to riding that roller coaster. While there are extreme examples of obesity on TV shows, most bariatric surgery patients are a lot like you or someone you know. Regular people who have struggled with their weight for too long. There is safe and effective treatment for obesity, and it's not extreme. Join the 200,000 Americans who take control of their health each year by undergoing bariatric surgery. Obesity can be effectively treated, but you have to ask for help.
Dr. Ayola,
Yes.
what is your favorite surgery to perform?
Wow, favorite surgery to perform? Probably, and it's hard to choose. I like the sleeve and the DS. The sleeve is great because it's a straightforward operation, very quick, very easy to perform for the most part. But I like the DS because when I do the DS, I know I am making a huge impact on the person's life, because people that need a DS have more weight to lose, and it's just more dramatic, the experience they go through afterwards.
My name's Amy Kaslick. I am 45 years old. My weight loss journey probably began when I was 12 years old, if I must be honest. I've been overweight my whole life, tried anything and everything. I have done Weight Watchers, Jenny Craig, Slim Fast, Atkins, Ideal Protein. Just never got anywhere with it. I really didn't, but I kept trying. And a friend of mine at work came up to me and she said, "Hey, I'm getting weight loss surgery." And I looked at her and I said, You're not big enough for that. How can you get weight loss surgery?" She said, "Oh, no. I am." And she told me how much she weighed and was within 4 pounds of me. And I thought, wait a minute, maybe I can do that too. So I found Dr. Ayola, and I will say that was location, but when I met him, it didn't matter. I knew he was the doctor that I needed to pursue this with. The reason I selected him, and really what I call a real doctor is someone that will take the time and talk to you and really get to know you and have that interaction and not come in and have a few words that they say to everybody and then they're back out the room. He really does take the time that you need. So I think my life has improved since weight loss surgery in so many ways. I have so much more energy. I have so much more confidence. So I love to travel. I've had the benefit of traveling all over Europe in the last year. The friend that I go with, we had the opportunity at one point to go to Italy together. And that was my before. That was me at almost 240 pounds. And I remember just having a really hard time keeping up with her as we were walking through the city, and became very just frustrating to me. The last 5K we did, I beat her. I loved it. I loved coming in ahead of her, and that was a goal of mine. After I lost weight, that sounds terrible, but I'm hugely competitive, so it was a goal of mine, and beating her in that race was awesome. So my advice for people struggling with weight loss is, I'll say, I will, and it's kind of like you want to keep it a secret that you've had weight loss surgery, because you still have the people, oh, that's it, that's the easy way out. It's the best way out, is what it is.
Take these medications as long as they meet the criteria for these drugs. Now, in the medical field, when we talk about weight loss, we use the term body mass index, or BMI, a lot. That's kind of the marker we use. It's not perfect, but it serves its purpose very well. In general, weight loss drugs are indicated if your BMI is over 27. So your body mass index ought to be over 27 with a medical condition, or your BMI has to be over 30. And so anyone that meets this criteria can take the weight loss medication. However, most weight loss drugs are going to drop you about 30 to 40 pounds, since BMI point correlates to 5 pounds on average. So if you do 30 pounds divided by 5, you're talking 6 BMI points. If you divide by 40, you're talking 8 BMI points. So in general, 6 to 8 BMI points is probably a reasonable, safe range to assume. The goal is to get your BMI under 30, because obesity starts with BMI 30. So if you do the math and someone's BMI is, let's just say, 48, and they have perfect success with a weight loss drug, their BMI is now 40. That's better than 48, but it's still a far cry away from the BMI under 30 that we're looking for health reasons. And so anyone can take a weight loss drug once their BMI is over 27 or 30, but not everyone will see the ultimate success they're potentially looking for with a weight loss drug as compared to other modes of weight loss.
Body contouring is one of the most popular aesthetic procedures in cosmetic medicine. The optimal solution requires a minimally traumatic local reduction of adipose tissue, combined with significant skin contraction. The body tight contouring procedure uses radiofrequency energy for internal fat lipolysis and external collagen contraction. RF energy flows from the internal cannula toward the external electrode placed on the skin's surface. RF power is regulated based upon online measurements of skin temperature and tissue impedance. The heat generated around the cannula tip coagulates blood vessels and liquefies fat to reduce post-operative pain, bruising, and edema. Uniform RF thermal exposure aids, smooths, and evens contour results. Thermal contraction of fibrous septae and dermal collagen results in immediate body contouring, which continues to improve over the next 6 months.